12:04. So let me start here. Again, if you have any questions throughout this little lunchtime sharing session, feel free to use the Q&A session. I will also try to monitor the chat a bit. So if you have any questions while I'm running through this, just feel free to share that and I will try to answer your questions as we go. Cool. So just to start, here's a QR code also to download the blog, to download the report as well. About myself, I'm one of the founding members of Galen Growth. I'm taking care of everything that is tech, data, research, analytics as my position as Chief Research Officer. If you want to connect with me, this is my details, both email as well as my LinkedIn to connect with me. Happy to stay in touch, happy to answer any questions beyond this little report today as well. If you want to have any other small chat, coffee, etc., so feel free to simply reach out to me. About Galen Growth, quite swiftly, we are a global organization that is tracking the activity of digital health. It's basically a think tank that is looking into digital health and how it's being used across industries by decision makers, as well as how ventures are using that. Headquartered in Singapore with offices in Basel, Switzerland, as well as in Chicago in the United States. We are working with our clients throughout the globe to help them innovate themselves. About 4-5 years ago, I released a platform called Health Tech Alpha, which is the go-to marketplace for digital health information, tracking at the moment about 15,000 digital health ventures globally and everything that is around them. Which partnerships do they have? Which products are they releasing? Do they have any clinical evidence globally in terms of publications, in terms of regulatory approvals, etc.? So if you are looking into such sort of information, we now also implemented AWS QuickSight for you to easily implement and analyze trends within the digital health ecosystem. About 2 days ago, we went live with our ecosystem dashboards, which basically lets you apply filters and interpret the ecosystem overall, so you can delve into geographies, to particular therapeutic areas, not just funding and partnerships, etc., but more on a very macroscopic point of view. What I was mentioning prior to that, this is the first report that is available. That is the global report that went live about 3 hours ago, and we will be releasing our North America, Europe, and Asia Pacific report in the coming weeks. These will be exclusive for Galen Growth Premium subscribers, but the global report, as we kept it also last year, is our free report. It's about 86 pages of in-depth information about digital health. So feel free to download it. If you joined a bit later, I'm going to have another QR code at the end of the presentation where you can download that. Otherwise, you can just go to our research page on both Galen Growth as well as Health Tech Alpha to find the report there as well and how to download it. Some of the key insights that we have from this report, basically the headline is that digital health has been very resilient despite many of the struggles that we've seen over the past 2.5 years now, since the more critical crash that we've seen in the venture funding activity. This year has been very resilient, with 34% more funding deployed as compared to last year. We've also seen more deals. Some of the US players have also released their numbers, which are highly off what the actual funding amounts and the actual number of deals have been. We are tracking everything from very early stage to very late stage. So it could be that there's always a bit of a discrepancy of how you identify digital health as well. But in our framework of how we are defining digital health, the value and volume is both up overall. We've seen that ventures have gained a momentum back in 2021. The funding stress is slightly easing. Funding strength is also growing. What we mean with this is we've seen that over the years, ventures have had a longer time or longer velocity between raising funding rounds. This has now been slowly easing, with about 2% points more in North America raising funding within the past 18 months. Aligning with the Europe 42% that we had at the end of H1 as well. And we're also seeing that based on our forecast, our Health Tech Alpha forecasters, that ventures that have an above average venture signal are more poised to stronger growth overall. So we can really start predicting which ventures are going to raise funding in the coming month based on how they're performing, in which industry are they in, which market are they in, who are their key investors as per this moment in time, and therefore who are more likely to be successful in closing the next funding round. We're also seeing that there's more activity from the health systems. 21% of all partnerships that we've seen in the first half of this year have been done by health systems. There's been a strong push towards this research solutions, how we call it, which now has the fancy term of tech bio. It's the top cluster for digital funding again, capturing 20% of all funding, about 2.6 billion dollars that have been deployed across 63 deals. There have been a lot of mega deals as well within this sector. So I'm going to focus a bit later on that as well. And then lastly, if you don't have AI in your solution anymore, you're basically already lost. 57% of all ventures that have been raising funding are using some sort of artificial intelligence. And we do start seeing a slight push on this Gen AI module, even though more towards the early phase or the early stage. It takes about 2% of all ventures that are raising funding with it. Now let's look a bit more into the funding insights and how this has been growing. So what I was already saying, we've seen an increase year on year of about 5% already. This has been quite strong. And we've seen that overall, we've seen less deals. That is generally quite common as deals are reported later as well. So we will start seeing that the 719 deals will slowly ease up or go up over the next 2 to 3 months as well, as more deals are coming through. Generally, we have a lag of about 2 to 3 months to have all funding deals properly collated. This is just because of how ventures are going out with their PR or are declaring things to the regulatory bodies, etc. This is the growth overall. So we've seen the 5% increase funding year on year. North America has seen the strongest growth. If we compare just annual 2023 against H1 2024, we've seen that this is already at about 60% of the funding that has been deployed last year over the entire year. Therefore, we are predicting that there's going to be an outperformance as compared to the total funding invested over 2023 as well. When we are comparing both Europe and Asia Pacific, these have been lagging slightly behind. Generally, Europe is more active towards the end of the year. So this one could very likely balance it out again, looking at about 40% currently raised as compared to last year. Asia Pacific at the moment looks a bit like it will again underperform after halving between 2022 and 2023. We will see how, especially the funding in China and in India are picking up and therefore leveling this current gap that we are seeing better out. When we look into this is how it basically looks at the moment. 13% more funding deployed in North America, with all other regions down. Middle East down 42%, very highly driven by some of the geopolitical issues that we are seeing in Israel, which generally represents about 90%, 95% of all funding being deployed within the region. Africa slightly down, which is not a surprise. And Asia Pacific down at the moment 14%, which again, what I was mentioning, if China or India are picking up on funding deployed with some of the geopolitical tensions easing, could very likely level it out, if not being slightly lower as compared to last year, but we shall see. This is a preview from the H1 2024 Asia Pacific report, basically looking into how much Asia still contributes to the global funding invested. It's about 9% as per H1 2024. This is not as good as it was in the previous years, and we've seen this slight drop over the years, with this year being the most, call it almost worrying drop that we've seen, contributing less than 10% of the global funding invested, as we see North America really ramping up again in terms of which funding is being deployed where. However, what we've seen is that Q1 has actually been quite strong. There's been more funding deployed in Asia Pacific. H2 has been here the contributing factor. So we shall see what Q3 and Q4 are actually bringing in terms of seeing whether the funding is ramping back up or not. Now, mega deals. It's generally a contributor of why a certain region is expanding in terms of their funding invested overall. We've seen that the majority of the funding here, again, 22 out of 26 deals in mega funding has been deployed in North America. This is already more than 50% as compared to what we've seen right now. If we're just extrapolating that linear, and we're looking at 44 deals, almost on par with 2022, still far away from the 2021 high number of 117 mega deals being deployed. But we start seeing that there might be an ease if the economy remains as resilient as it currently is. So we are looking into funding being deployed very north of what we've seen in the past year, at least. It's yet to see whether Europe and Asia Pacific can pick up with that. Mega deals in this region are generally coming out of China or out of India. I haven't seen that much activity of mega deals in digital health as of now, but shall see how this goes towards the second half of the year. Together with the rise of mega deals, there's been a couple of interesting value points to see here as well. How much is the actual funding that has been raised within? So this has been on the rise as well. We see about 82 million is the average size of a funding deal of a late stage round, 27 million is the one of a growth stage, and 8 million is the one of an early stage. So there's a few things that we're seeing here. Early stage deals continue to rise. This is largely driven by the fact that startups are raising funding significantly later, and therefore we start seeing higher valuations, therefore more funding being invested in earlier rounds. B, it requires significantly more cash to actually get somewhere. So we're also seeing that ventures are coming out of stealth with an undisclosed funding round being raised prior to them even coming out of stealth. And therefore, we also see the early stage rising again. We start seeing that the growth stage, and this is where the majority of ventures are failing at the moment, is rather stable between 23 and 24, after being very high back in 2021, where we've seen also mega deals happening within the Series A, Series B phase. This is rather static. This is largely driven by the fact that many ventures have looked into validating their solutions and couldn't do that. Therefore, currently the pressure is extremely high in these early growth stage deals, and therefore the funding amount raised in there is rather flat. Also, many investors are currently not looking into that. They're either looking to early stage or looking into late stage. With there being a crunch on Series A, Series B investors, taking the risk where the risk appetite is still low in the current economic market. And therefore, we start seeing that the growth stage is particularly the one, or the growth stage ventures are particularly the ones that are currently suffering. And then the late stage one is where we start seeing a massive pickup again with 5 million more on average raised, which will slightly slowly inch towards the 2022 number, because we're seeing that there's lots of consolidation within the market. Ventures are acquiring others. You require cash to acquire. And therefore, the amounts of funding raised that the late stage rounds are generally growing at the moment. We're also seeing that AI ventures are capturing a larger amount of the funding. When we look into the average percentage of ventures that leveraging AI is generally higher as compared to the ones without AI. This in the report is on 2 different slides. So you will see here the without AI you will find on slide 19 generally. I'll put them side by side just for you to have a comparison here. And especially the one that are in late stage are generally raising capital more actively. Here, about 3 percentage points are the ones in early stage that have, are the ones in late stage within the past 12 months that have raised funding, the ones with AI versus the ones without AI. So AI is generally one of the factors that you currently need to have so that you can easily raise your funding. Overall, this Gen AI boom and everyone talking about it, ChatGPT implementation, and I'm having my little chatbot available, is still a very nascent field, primarily driven because of the privacy issues that are coming with it and who actually owns the data that are being collected within. So yes, we start seeing ventures using it, but we only see about 2% of ventures using Gen AI solutions, looking into your large language models and your open AI sort of solutions, particularly across the research solutions where we start seeing drug discovery, molecule binding into protein structures, etc. These are the ones who are generally using it. Not so much yet used by medical diagnostics or by patient solutions, where you still have the interaction with a physician, for instance, which the patients consider as more reliable as compared to a chatbot, as per now. Looking into partnerships for a second, we literally reached the highest number of partnerships ever achieved in a quarter in Q2 2024 ever, with 807 partnerships announced within 3 months. This has been quite impactful, considering that partnerships are generally commercial partnerships or strategic partnerships, especially on the strategic side. Especially on the commercial side, these partnerships are important, as we see that funding generally is still very fluctuating in terms of whether it will be higher or lower, but the more partnerships, and especially commercial partnerships you have, the more revenue you can generate, and therefore the more solid your solution is also within the market. We do see that the majority of these are happening in medical diagnostics and health management solutions being the ones that are particularly implemented within the health systems overall. These have been always the strongest in terms of partnerships as well, but we start also seeing that we also still see that the majority of these partnerships are still coming out of North America, while we do see that Europe and Asia Pac are slowly picking up in terms of how many partnerships are announced, which is generally interesting to see of how this is also evolving. The majority out of these partnerships are coming out of healthcare providers, as well as then cross-venture partnerships. So Venture A partners with Venture B. This is particularly for market expansion to consolidate their solutions into a single service that they can offer together. Pharmaceutical still being extremely strong in terms of how they're partnering, especially in the research solution bucket here as well. So interesting to see of where this also goes moving forward. Clinical evidence is generally important as well. So when we compare publications, regulatory approvals, and clinical trials run, granted, and performed in the first half of this year, we're roughly on par with how it was in the previous 3 years. We're looking at the moment at around 4,000 publications digital health that have been published so far this year, with a number of regulatory approvals granted, though significantly less than back in 2021, for instance, as well as clinical trials that are roughly half, slightly more than half of what we've seen last year, with significantly outperforming the previous years. So we do start seeing that there is this heavy push towards gaining evidence extremely early, as you try to leverage your solution and place it in the market with already valid clinical reasoning of why your product is superior as compared to some of your competitors. Interesting also, which might not be, it's actually listed here, North America is slightly picking up, but we do see that the majority of the ventures that have an evidence signal of higher than 40 is still in Europe, with North America and Asia Pacific still lacking behind that. This is often also of how the solutions are and what are they trying to solve. You do not need for your telemedicine solution in Vietnam a regulatory approval per se, because you are not providing a service that directly impacts the patient. You're more bridging between two different, between the patient and the provider. And there are more, and they are responsible to holding your privacy and making the medical decision here. Exit activity overall has been strong as well. We've seen more consolidation within the market. M&As have been up as compared to the first half of last year. Still lagging behind what we've seen in H1 2021, however. But there's a strong consolidation at the moment, as we see that ventures are struggling, others are raising significantly more amounts of cash, and therefore we start seeing more acquisitions. Also, the number of ventures being acquired by other ventures reached its highest ever. There's about 70% of all ventures being acquired by other ventures, which is generally, it's a mixture out of concerning and good at the same time, because if you are a pharma or insurance company, you only want to work with one player, not with two. But at the same time, if we don't see a consolidation whereby companies acquired from a large company, let's say a pharma or an insurance company, the transaction in terms of monetary transaction is significantly lower, is often more of a share swap. And therefore the actual value created to investors is low, and therefore the risk of investors pulling out from a deal could be potentially higher. So there are pros and cons of this at the moment, depending on from how we are seeing it at the moment. But what we are seeing is that most of the transactions are happening between ventures and ventures. Some of the very active investors, not a surprise, it's all US-based investors. Anderson Horowitz, very heavy on this B2C healthcare trip that they've announced last year, I think. General Catalyst has been traditionally being one of the most active ones, especially in the early stage phase, but then they're driving this through all the way to late stage. Khosla Ventures has been also extremely active and has been so far the most active investor overall in digital health with 174 deals since 2010. Based on our forecaster, I just put one slide in there. Some of the things that we can basically see. So if we look into a venture and how they're performing as compared to their competitors, we start seeing of why, for instance, GC invested here in Sword Health. Alpha score was significantly outperforming the lower, median, and upper quarter. So no brainer of investing. Momentum score significantly higher, more regulatory approvals, more often mentioned, more users on their platform, etc. Significantly more strict with their money. So 3 times higher than the upper quarter that we are seeing in terms of how strong they are with their musculoskeletal solution or the pain management solution. Also in terms of innovation, so what are they actually using? Significantly more advanced. So overall, it's basically a no-brainer why someone would invest in this, and this is something that we can generally also track within HealthTech Alpha overall. Good. As we are edging to my 25, now 26 minutes, just as a quick summary, there are a few things that you will find in the report that I couldn't share with you because I have a lot of things to go through. There are about 84 pages of digital health information about Global. You can scan this QR code, or you can go onto our website. And you'll find significantly more information about that, including the slides that are listed out here as well on this particular page. If you would like to get more in touch with me or with someone else, you can always contact us via email, phone, whatever you're interested in. Contact us on social media as well. With this, I'm basically done with my little chat for the day. If there are any questions, feel free to drop them now in the Q&A section as well. Otherwise, I will be leaving this chat in the next 3-4 minutes.